PP is on for my team and I. Is our scene safe?
The scene is safe.
Where's our nearest ALS?
Nearest ALS is coming from 20 minutes away.
And our nearest hospital?
Nearest hospital is 10 minutes out.
What's my nature of illness or mechanism of injury?
The call was for a fall.
Okay. How many patients do I have?
You just have one.
Okay, we're going to consider the need for C-spine at this time. As we approach our patient, is the patient tracking?
Patient is unconscious.
Patient is unconscious. Hey, can you hear me? Can you do me a favor and grab C-spine, please? Patient is not responding at this time. My respirations appear to be 14 breaths per minute. What do I have?
You have 14 respirations.
Okay. My patient does have radial pulse present at this time.
Yes.
Okay. Can I get the pulse ox on him, please? Okay. Do we know what happened? Are there any bystanders?
The patient's mother states that she saw him reaching for some cookies on a high shelf when he suddenly slipped and fell, and he became unconscious after he fell.
Okay. My patient, he seems to be breathing okay. I'm going to go ahead and put him on a non-rebreather mask at this time with 15 liters per minute. If you could grab that for me because he's unconscious. Do I notice any major bleeds?
You do have some a steady flow bleed from his right wrist.
Right wrist.
And does appear to have a deformity to that wrist as well.
Sean, with this deformity and bleed, can you apply pressure, please? And can we get the cardboard splints ready to bandage? 15 liters non-rebreathers going on my patient at this time. I did notice a bleed to the right radius. How are my skin signs?
Skin signs are pale, cool, and clammy.
Okay. That is a sign of possible shock for this patient. He is on high flow oxygen. He is laying flat. We will cover him with a blanket to preserve heat to, again, further treat for this bleed on my patient's arm. I'm going to go ahead and start with my head-to-toe assessment on this patient at this time because I have airway controlled. My bleed is currently controlled. He does have a radial pulse present, so I'm okay there. And you said no other bleeds or deformities that I can see?
There's no other life-threatening bleeds that you can see.
Okay. We'll do that after I do neck. I'm going to check my patient's head. Any decap BTLS?
Patient does have a hematoma to the back of the head.
I'm going to take note of that hematoma to the back head, and we'll be careful when moving this patient. Anything in the orbits or the nose, mouth?
No, the face is stable.
No broken teeth?
No broken teeth.
Any blood or CSF coming from the mouth or nose?
No.
Is my trachea midline?
The trachea is midline.
Do I have any JVD?
No JVD noted.
Any step-off or injuries to the spine in the back?
No. He does groan when you palpate the neck.
He does groan, so we're going to go ahead and apply a pediatric C-collar to my patient's neck now that I've cleared the neck. And we're going to maintain C-spine the entire time for this patient because we are unaware what the injuries may include. I'm going to continue my assessment. Because he's unconscious, I'm going to remove my patient's shirt. Do I notice anything as I remove the shirt?
No obvious deformities or injuries noted on the chest.
Palpating the clavicles. Anything?
They're stable.
Clavicle stable. How is my sternum midline?
It is midline.
And no decap BTLS noted?
None noted.
Ribs in and down?
They are intact.
Okay. Down to my abdomen, all four quadrants in a rolling motion. Do I notice any distension, heat, rigidity, any deformities in the abdomen?
The abdomen is soft, non-tender.
Okay. I'm down to the pelvis. I'm going to go in and down. Is it stable?
It is stable.
Okay. I'm going to straighten this leg out. Okay. Any propriopism for my patient?
None noted.
Okay. I'm starting with the left leg on my patient. I'm going to go up and down, front and back, checking for any bleeds or decap BTLS. Anything in the left leg?
None noted.
Okay. Same thing on the right side. Anything there?
None noted.
Are my pedal pulses present?
Yes.
Okay. I cannot check motor sensory at this time because my patient is unconscious. I'm moving to the arms. Is my bleed controlled on the hand?
The bleeding is controlled.
Okay. With that deformity, can we go ahead and place a splint on this patient's arm? Before we completely secure that splint, I want to quickly check pulse, motor sensory in this hand. However, I cannot check motor sensory. Pulse is present at the radius.
Yes.
We're going to pad the voids around the elbow and the wrist for this patient to make sure that this limb doesn't move as much as possible. Any other issues with this right arm?
None noted.
Okay. Same thing on the left side. Do I notice any decap BTLS?
None noted.
Radial pulse is present?
Yes.
Okay. Once that's secure, we're going to roll this patient quickly so that we can get him on a backboard and I can examine the back side. Because he's injured on his right side, I'm going to roll to the left side. Thank you. I'm going to move this chair out of our way. Because he's injured to that right side, we are going to roll to the left side. So if you guys could do me a favor, come on over here. Sean, can you grab the backboard for me, please? Thank you. The arm as secure as we can possibly get it. We're going to keep it by his body. And then we're going to go this way. We have to roll to his left side. Thank you, Sean. Okay. So secure the arm to his body as much as you can. You and I are going to cross hands. I'm going to have you here. We'll go there and here. So on heads count, Donna, we're going to have you count to 3, and we're going to roll towards us.
1, 2, 3.
Okay. As my patient's on his side and the shirt is already removed, do I notice any decap BTLS down the spine?
None noted.
Any step off?
None.
Any other bleeds that I have missed?
None.
Okay. Because everything's stable there, there's no need to do anything further on the backside. We're going to roll him onto the board on heads count.
1, 2, 3.
Okay. Now that he's on the backboard, we're going to secure top, middle, bottom, head. So if we could, he's unconscious, we'll secure his arms into the straps because he is unconscious. If he were awake, we could leave those out. Once we've secured him to the board, I recheck pulse motor sensory. Pulse is present right radially.
Yes.
Okay. Pulse is present distal on the feet.
Yes.
Okay. And again, I can't check motor sensory because my patient is still unconscious. If my patient were awake, I would have attempted a sample history. I could also ask mom if this patient has any history, allergies, or medications to be aware of.
Mother says none noted.
Okay.
Doesn't take any medications.
My patient is a high priority. We're going to load and go to the nearest facility. I will finish the rest of my assessment en route. Donna, because the patient's head is secured, we're going to tape him happy face, sad face to the board. You can go ahead and let go of the blocks there. Scott, I'll have you grab the head of the flat here. Donna, you got the oxygen tank. You good with 2-point lift? Okay, ready on heads count?
1, 2, 3.
Coming to the gurney. Secure the patient to the gurney. Okay. We're going to load and go to the nearest facility. Most appropriate for this patient is going to be Kern Medical because of the trauma. If there were no trauma activation, we could go to Memorial, the pediatric center here in town. En route to the facility, I'm going to reassess this patient. I'm going to start back with ABCs. Is my airway still secured?
Yes.
Okay, respiration rate and quality at this time?
Respirations are 16
Okay.
and equal.
Okay, and oxygen saturation at this time?
Oxygen saturation is 100%.
Perfect. I'm going to assess lung sounds for this patient because he did take a fall.
Lungs are clear bilaterally.
Okay, cleared auscultation in all fields bilaterally. I'm going to also assess pupils at this time for my patient.
Pupils are equal and reactive to light.
Pupils are pearl. En route to the facility, I'm just going to keep monitoring this patient. I'm going to make sure that the airway doesn't change and he continues to breathe on his own. I'm also going to keep a close eye on this arm and make sure I don't notice any further bleeding come through our bandaging that we've secured. I'm going to give radio report to our hospital. My patient's GCS, because he's unconscious, appears to be about a 14. His AFPU status is he is unconscious at this time. I was unable to determine any level of alertness for this patient. My patient's mom is going to ride with so she can give further information. And I want to get a little bit more details about my patient's fall. I understand that he stood on a chair to grab a cookie. And approximately how high was that fall?
Probably about 4 to 5 feet.
Okay. We did notice a hematoma to the back of the head. Mom, does she know if he passed out at all?
He was unconscious when she saw him fall.
Okay. And she's been unable to awake him the whole time?
Yes.
Okay. So patient remained unconscious, which is positive LOC for this patient, which is a major concern for us. Pupils were pearl.
Yes, they were.
And there was no external bleed on the back of that head. It was all an enclosed hematoma, you said?
Yes.
Okay. That is it for our patient. We'll get there as soon as we can, and we are complete with this trauma assessment fall. Okay, so we assessed our patient who had fallen from a chair. He was completely unconscious the entire time. The one thing I would like to reiterate is his GCS scale. I took the approach of giving him a 14 out of 15 on the scale, and that was incorrect. The GCS scale is based off eyes, verbal, and motor responses. I did check my patient's pupils, and they did react to light. However, he was unable to open and close them on his own. Therefore, he's a 1 within the eye area. His verbal, the only time we got any type of verbal response out of this patient was a groan when palpating the C-spine. Therefore, we'll give him a 2 in that area. As far as motor goes, he did withdraw slightly to painful stimuli. Therefore, we gave him a 2. So we're going to give this patient an overall GCS of 5 out of 15.